Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk a little bit more about adenoid tissue and the problem you develop from having oversized adenoid tissue, and it can go down to have unusually large tonsils too. You can look in somebody's mouth and have them go like that, and you can see the tonsils on many kids, and I've got some of those that I'll show later on where the tonsils are big. They'll have a number 4 tonsil is one that's touching on both sides, and they'll swell up and they can't breathe good from that, and they need to have the tonsils and adenoids, and usually they get both when you send them into the pediatric, for the pediatrician that's going to take the adenoid tissue out. He might take the tonsils out at the same time. All right, let's get going on this young lady. And it's an interesting case there. Of course, I'll say they're all interesting. But here's a young lady, real nice. And we had a brick background there for the face. You don't see it very good, and good facial structure, though the height of the face, the thirds and everything looks good, and there's no problem in that areas. And so we didn't have to do the palatal separator that I did on the previous adenoid tissue problem. And there we're into the case already. Before I got these pictures, we're bringing them down, but I'm going to go back on the models and show you what some of the problems, like this central right here is turned sideways and sticking out over here, and something over in this area is wrong and screwed up, and so we have to go in and kind of straighten all that out. That's just simple orthodontics. So in the teeth, we've got closed bite with the lower teeth coming up here, hitting her at the tissue behind the upper teeth. So that's another problem. The palate is not the problem here. We didn't have to widen the palate all that much. So your upper teeth are extending out over the lower teeth. And here's the way they should meet. On the lower teeth in here, and your upper tooth should come down and come like this. And that's the way it should be. So the upper tooth keeps the cheek out of here. I'm a mouth breather, and my bottom teeth are right even with this, and I'm chewing my cheek real frequently unless I put some food in the cheek sometime when I'm eating. I'm trying to get something in there to hold the cheek out away from my teeth. I'll bite my cheek like that, and that happens. So anyway, we didn't have that problem in this particular case. And over here, we're just about in a class 1. Really, the 6-year molar needs to be a little further out like this. And so we got a little class 2 problem, and we have a little class 2 problem out here in the front. And the centrals, I don't know what caused it to grow like they did here, but anyway, this central is out like you got something up above the root that keeps it from coming out where it should, right there. All right, no big deal though on any of this stuff. And we're going to use an occipital headgear, and I'll show you a good bit of other things where we use the occipital headgear. So this is the lower, this is 12 of 85, and here again is the adenoid tissue. If you look at it right in here, this area right here, the airway is not as bad as it was on the other case like that, and still she's a tongue thruster, so I think we put fingers out there to train the tongue from doing that. Now, the tonsils, you can actually have them go on and lower their tongue down, and you can see the tonsils down in here on a lot of these cases where you have tonsils swelling up, you get irritated and kind of pussy-like looking. So that's here we've got enough problem with the adenoid tissue. All right, over here is probably one of the reasons for the central tooth going off to the side or something. These two teeth came in good. This one came over to the side, and you got to take this thing out and get it out to straighten that up and line that, and then we got to bring these 4 teeth into this space left, and these 4 teeth, 3 teeth come in here like that. Same thing down on the bottom. You've got these 3 teeth. We're going to have to fit them in this gap right in here. All right, same thing over on the other side. So this is a simpler case, and it didn't have as many things wrong as it did with that young man in the other case. So we are leveling the bite, but here we banded the 4 anterior teeth, and we put this, you've got a tooth coming like this, with these roots down, and we put a band around that tooth, and we solder 030 wire to this right here, and then we bend this back so that it catches the tongue, and then they'll be coming up here and pushing the tongue out, and this will catch it right on the bottom of the tongue. And you can break a tongue thrust like that, but you need to open the airway first. You need to get the airway open before you try to stop the person from swallowing wrong and do that. So we put the tongue thrust in there, but then I get the adenoid tissue removed before we go, or get the airway open. If it's an allergy case, it's really tough to keep somebody breathing through the nose and stop them from breathing through the mouth. That's hard to do. So anyway, we got these little fingers back there, and those work. I mean, we put those on, we don't mess with that tongue. I mean, the tongue will go up there about twice and hit those little sharpened wires. They don't have to sharpen them, you just go up. And I had this on a medical doctor who was a bad tongue thrust, even after he was out practicing. And I put these on him, and I said, I want you to tell me exactly how your teeth get along on here. And he told me, he said, my tongue went up there and hit him about twice, and it irritated it. And after that, the tongue won't even go up there close to him. And so you wear them for a good while, and you break the tongue thrust habit, but you need to correct the breathing problem on kids before you get that and start doing that. So here we've got these tongue thrust plants, and they're working on 4 anterior teeth. So I had to have these bands on the lower teeth to solder those on. We want to solder them, and then we weld them. In addition to solder, we spot weld the wire to the tooth. So we don't want to lose one of these. If you do, you swallow it. And we've had a few people swallow some of those if you break them off, but we followed them, and they don't hang up on something inside. So here we've got this going. At this time, we're in the mixed dentition now. These are all deciduous teeth coming in here, and so we've got anterior teeth that are permanent, 6-year molars that are permanent, second molars coming in here, and this is age 9-6. The wisdom teeth, if they're going to form, I don't see much where the teeth are forming. Now I'm going to erase that, and you can see it a little better when I take it off there. Okay, let's look. Now we're down here and she's 10 and 8. And so we've taken this out. We've got her finished to this point, and we've got one wisdom tooth forming over here, and maybe one up here and up here. And this is a situation. She's 10 and 8, and her 12-year molars are not, and that's a wisdom tooth right there. You can't see it much, but we're going to have to watch this case now and go into the permanent dentition, and we may have to come back and do something, or you may get the teeth in there without having to come back and reband it again. So let's see, that's H 10 and 8, and here this is 8 and 6, so this is back. We're just starting over now on the showing the bands as we worked up to them, and we'll go back and work it up to where we were. Now you can see where we put these together and lining this up. There's no problem. This is a simple. This is plenty wide, so we didn't need any lateral separation in here. So we're sitting in a pretty much class 1 relation. Now there are the bands. We had these teeth banded, and these are going back, and the tongue rope comes in and hits those and stops. And we stuck a mirror in here, and that's why you see this part of the tongue sticking over there. That's a mirror reflecting there on that area. Now this is the occipital headgear, and we want to set that thing where it'll pick the arch up. And so in this case, let's look at it from the side. The arms of this are cut off right about where the front teeth are. And so here you're picking the anterior part of this up, and it kind of pulls this part up. If you're wearing a class 2 elastics, it stops from pulling these teeth down, and you can back the maxillary teeth up, and you cut that bar here, and if you cut the bar about halfway over, it'll do a different thing. You go back to the back, it'll pick the teeth up this way, or it'll pick them up this way, or it'll pick it up from the anterior where you connect this bar. Now I want to show, this is the outside part of the bow out here, and we cut this pretty short over here, and we've got a spur coming inside, and this little spur we put under our arch wire. So, and the bar, these are out something like that right here. So we're picking this portion up, and if you move this bar, the hook back further, you can pick it up from here, or you can get back where the molars are, and you can pick it up like that. So we haven't explained that on some of these headgear cases. Now this is occipital, come down from the occipital bone like that, and you cut the arms where you pick up what you want to raise up. So if we're pulling back on the front teeth and we won't want them coming down, we can keep them raised up by using this little occipital headgear, and this bar, we had them just made with that. You put that between the centrals. All right, we brought this back, and this is 5 of 88, and we were watching the eruption of these teeth into the mouth. Excuse me. We put a retainer in here, and sometimes you don't need to do anything with the rest of it. But we've got some deciduous teeth that's still got to come out, and we have to watch this case. So you have a first phase, and then you take it off, and you have to come back and do a second phase, and sometimes you don't ever come back. I mean, they come in good order, and you don't have to do the second phase. Now it's fitting like that. We've got this permanent teeth on this side. We've still got a baby tooth right here, and we'll have a little space to close up there. Up above now we've got several deciduous teeth in there, so you have to watch the case till you're through. But I'm stopping this case here to show you what we did for the adenoid tissue. We took that out and cleared the airway. We put a tongue thrust deal in to stop the tongue thrust, and now we are going to sit there, and when the permanent teeth come in, we may have to come back and do a final deal of lining the teeth up. But many of them, we don't have to come back and do that. They just come on in good. You've got a retainer in there, you hold them in place, and nobody's teeth come in exactly where they should. As they erupt in, the cheek catches them from out here, and the tongue pushes out on them, and the teeth line up. And I don't have the finishing stuff on this case right here, so we will say goodbye. It just shows you what we had to do early, and then you stop working on them, and you may have to come back and do the second phase of the orthodontics to finish the case out right. So thanks for watching, and I hope you get something from this video. And if you do, subscribe to our channel and let us hear from you again. I appreciate each one of you, and I don't know where on earth you are or anything else, but wherever you are in the world, this is not the same thing that can happen with your teeth. Thanks again, and I'll say goodbye, and I'll see you again in another video.